So for more on this, SABC News Foreign Editor Sophie Mokoena joins us now. Very good evening to you, Ms. Sophie. I mean, this has been described by some commentators as South Africa's delay in getting these vaccines, with the President issuing, of course, that letter saying soon. Do we know what soon really means?
When I spoke to our correspondent, Puna, who you just heard now, she indicated that the authorities in India have indicated that delivery will be done this week, and we expect before end of the week to receive the doses from India. But what is also good to know is that earlier on, Dr. Tedros, the director of the WHO, indicated that he had a discussion with President Ramaphosa about this matter. The briefing today focused solely on issues of vaccine nationalism, and the leaders, they're trying very hard to ensure that they are able to convince the developed nations to assist WHO in pledging on COVAX facilities so that the poorer countries can be able to access this vaccine. Let's take a listen at what Dr. Tedros had to say on issue of vaccine nationalism.
Vaccine nationalism could cost the global economy up to $9.2 trillion US, and almost half of that, $4.5 trillion, would be incurred in the wealthiest economies. In contrast, the financing gap for the access to COVID-19 tools accelerator this year is $26 billion US. If fully funded, the ACT Accelerator would return up to $166 for every dollar invested.
And Sophie, this must be quite significant for South Africa, because I think at this particular point there are concerns that the longer there is a delay in this vaccine arriving in South Africa, as we head towards the winter seasons in the next couple of months, this process should have been rolled out quite extensively to avoid a resurgence of the virus.
Indeed, Griselda, the vaccine is likely to assist, but we cannot only look at vaccine as an alternative. That is why Dr. Tedros has also indicated that we must continue to comply with the WHO COVID-19 protocols. Unfortunately, at times, leaders are not leading by example. I mean, you just announced the Premier of Mpumalanga accepting that yesterday what she did was just out of order. I mean, if leaders don't comply, ordinary people will not comply, and will continue to have these numbers. But on the issue of vaccine, indeed, we are waiting. And earlier on, Dr. Tedros again spoke with President Ramaphosa, I think an hour ago, to try and find a solution in terms of what they can do to ensure that Africa, as the continent that has all the countries that belong to poorer nations majority, they are able to access vaccine. Let's take a listen at what Dr. Tedros had to say.
Less than an hour ago, I spoke to President Ramaphosa of South Africa. And on Wednesday, I will be speaking with Ministers of Health and Ministers of Finance from the African Union. I will tell them that we're doing everything we can to accelerate the rollout of vaccines in Africa to save lives and get their economies back on track. The rest of the world must play its part. The COVID-19 pandemic has reminded all of us that health and economics are closely connected, and that we're all in this together.
Sophie, I'm afraid that's where we're going to have to leave it. Thank you very much indeed for giving us an update on that. We appreciate your time here on The Full View.